and welcome to a brand new episode of COVID 360. I'm Sneha Mordani. On the show today, we will tell you all about Omicron, the fifth variant of concern that continues to spread across the world at lightning speed. The government of India says that close to 5,000 cases of Omicron have been detected in India. But looking at the surge, it's evident that this variant is driving the third wave right now in the country. The third wave essentially tells us another story. On the show today, we tell you about how the situation is in 5 poll-bound states in India. Also on the show, how do you go about getting a booster shot if you're eligible for it? Our focus is on Mumbai and Delhi, where the infection is hitting a peak. First up, this report on key statistics, vaccination progress and COVID numbers in poll-bound states in India. Take a look. Polls amidst Omicron. That is the biggest challenge before India today, as India's compulsions as a democracy force 5 states in the country to go to elections, albeit with strict protocol. But case count has gone up across India, and poll-bound states of UP, Punjab, Uttarakhand, Goa and Manipur are no exception. In Punjab, active cases jumped 12-fold in just 7 days, from 1,369 on the 2nd of January to 16,343 on the 9th of January. During the same period, the number of patients on oxygen support jumped from 33 to 254. There are 10 patients on ventilator now, as against just 1 a week ago. Test positivity rate in the state has also gone up to 12.6%, indicating that infection is quite widespread. Notably, the proportion of eligible population getting both doses of the vaccine in Punjab is one of the lowest in the country.
Another cause of worry is the higher number of patients who have been put on the oxygen support. According to an estimate, 264% rise has worried the state as more patients are being put on the oxygen support.
In Goa, the test positivity rate is at an alarming 25%. However, since vaccination coverage in the state is much higher than the national average, hospitalization remains quite low. Goa has the highest proportion of fully vaccinated adults, 96% among the 5 poll-bound states. And in UP, where political temperatures are soaring high, the positivity rate stands at 3.5%. What is worrying, however, is that active cases in the state have jumped over 15 times, from 1,725 on the 2nd of January to 25,974 on the 9th of January. Another concern is that the proportion of fully vaccinated adult population is only 53%.
What we have seen in Uttar Pradesh, that the doubling time of the COVID infection is very high. The test positivity rate, which was in Uttar Pradesh, it was 0.1%, and 0.1% has become 1.8%. Last year it was 18 times jump was in 30 days, and this time 18 times jump is only in 7 days.
In the midst of a sudden spike in COVID cases ahead of a hectic election season, the question that begs our attention is the trajectory the pandemic is likely to follow, with events such as rallies and roadshows.
India, a country that lacks social distancing, has repeatedly failed to follow the science on masks and ventilation, and we don't even have adequate testing and sequencing infrastructure. These elections are just going to be more super spreader events across these states, creating more infection, more disease, and more mortality.
But some public health experts say that essentials can't be postponed forever because of the pandemic. And in fact, the government must now work with public health experts and epidemiologists to understand how can they really work around the pandemic to ensure that life in general does not come to a standstill because infections are surging.
It has been 2 years into the pandemic, and no one can be certain that what will be the future course of pandemic. In this backdrop, it's important that we continue with the essential activities of life, be it a social, economic, or even democratic process such as elections. We really do not know when and what situation would unfold In that backdrop, it's important that elections are planned on the time.
The key will be how well social distancing norms are enforced. If the Election Commission is unable to ensure COVID-appropriate behavior in the campaign, the polls run the risk of becoming super spreaders. With inputs from Abhishek Mishra in Lucknow and Manjeet Saigal in Chandigarh and Samrat Sharma in Delhi, Sneha Mordani for India Today. Our next report tells you about how these poll-bound states are doing in terms of testing and getting the real data vis-a-vis infections.
There is the more cases of the corona. I think the maximum is in Maharashtra, followed by Delhi, Karnataka, and I don't think there's any election in this area. Is there any election here? No. Everything is still rising. So we cannot say that corona is only because of the elections.
This was the statement made by the Chief Election Commissioner about COVID cases in the 5 poll-bound states in his briefing last week. But is this really the case? How is it that poll-bound states aren't reporting a huge surge in COVID cases? India Today's Data Intelligence Unit has the answers. Our analysis shows that average daily testing in the 3 poll-bound states of Uttar Pradesh, Punjab and Uttarakhand has only marginally increased, not enough to detect a large amount of COVID cases. And this while states like Maharashtra, Delhi and West Bengal are testing aggressively. We compared average daily testing data from the 5 poll-bound states. The average daily testing in Uttar Pradesh from December 7, 2021 to January 7, 2022 is only near 20%. Punjab fares the worst out of all the polling states. Average testing in Punjab has fallen in the negative. The daily average testing in Uttarakhand has increased by 17.4%. Goa has doubled its testing numbers and is up by 47.8%. Manipur testing is up by 37.8%. Meanwhile, even in India overall, the daily average testing rose by 9.8% in the same duration. Health experts have varied views on what India's testing strategy should be in light of the Omicron crisis, which is highly transmissible, thereby shows a huge surge in cases.
Decision on physical or virtual rally need to be taken on the rolling basis. Some rallies might be required physical, other in virtual. Third, even if physical rallies are allowed, that opportunity should be used to convey and ensure stringent adherence to the COVID-appropriate behavior.
Some experts also worry that COVID could enter into parts of rural India, like in the second wave, due to super spreader events.
I don't see that even if you are going to test everybody, based on that you can say that this person is having the ability to transmit the virus and this person is not, because I told you that positivity can be due to various reasons.
India, meanwhile, has also changed its testing strategy. The latest guidelines of the ICMR on COVID testing are equally worrying. It states that asymptomatic people no longer need to test. If you came in contact with a COVID patient, you don't need to test. If you've ended your home isolation or stay at a COVID facility and no longer have symptoms, you don't have to test. Test reports again are not required for interstate travel.
Data shows that low testing will lead to lower case numbers, and that is exactly what is happening in poll-bound states. At the moment, when the Election Commission also has to review whether they will allow political rallies and campaigning back before the 15th of January, it's puzzling how they'll be able to make a sound decision if they don't have the correct number and the true picture of what's really going on the ground in these states that are due to go to elections. Milan Sharma for India Today.
Amidst a big surge in infections and demand for RT-PCR tests, the Indian Council of Medical Research has said that not everyone should go for tests. This new guideline on selective testing has invoked mixed reactions. Here's a detailed report. Contacts of those who are found positive for COVID-19 need not be tested unless they fall in the high-risk category. ICMR's new guideline is a big departure from India's test, and test strategy. But it is in line with the World Health Organization's call for prioritization on testing. The WHO's technical lead is of the view that when capacities are limited and systems stretched, testing will need to focus on priority groups. Those who should be tested on higher priority are suspected COVID cases. On medium priority are those who are asymptomatic individuals with high risk of exposure. On low priority, those with low risk of exposure. The guidelines by the ICMR have invited mixed reactions given that India is testing far below its capacity. India can undertake up to 5 million tests a day, but is testing only around 1.5 million.
In my opinion, Indian Council of Medical Research's latest policy on COVID-19 testing is epidemiologically sound and very pragmatic. It will reduce the unnecessary burden on healthcare system. In context of Omicron, what we need to remember that this is highly transmissible. There are many asymptomatic. So if we examine the benefit of asymptomatic testing, there is very limited benefit. One, at individual level, it does not help. Testing of asymptomatic does not help in clinical course management. And then from public health perspective, identifying asymptomatic may help, but you are going to miss a lot many asymptomatic. So identifying simply a few as asymptomatic is not going to alter the course of transmission.
The WHO has reiterated that not everybody needs to go for RT-PCR testing because resources are limited and that they must be used optimally. The Indian Council of Medical Research says the same. But there is a problem here, especially in a country like India where cases may be missed and there could be wider spread of the infection, faster spread of the infection. Also, home isolation guidelines could be violated. The view of some experts is that testing curtails transmission when the virus is on a rampage.
Tests do help us diagnose people and then decide on their further treatment, but they also have a huge role to play in reducing transmission of the virus. And hence the importance in the midst of a shooting up wave and in the midst of a pandemic, which is far from over. By stopping testing or by reducing testing, one, we are going to expose the vulnerable groups a lot more than we would be otherwise. Two, we would have no clue where the virus is spreading. Then that also means that we will not be taking care of if there are any new variants happening. Thirdly, we are sending a narrative that this is mild or this is something not really important. The testing is not really important. This doesn't send a right signal to the people, especially when the cases are on the rise. And we do know from the data world over that hospitalizations do increase and so does the severity of the disease.
The ICMR advisory recommends against testing low-risk contacts of a COVID positive person. However, this message is incomplete without emphasizing that a low-risk person can still transmit the infection to a high risk.
The WHO's argument is that testing is important from an epidemiological point of view. But when the caseload is too high for the system to cope, then prioritization is the sensible option. In New Delhi, Sneha Mordani for India Today. Now, as far as the third wave is concerned, let's take a look at the worst hit cities in India. Mumbai and Delhi cities are the worst hit cities. The positivity rate in Delhi is well above the 25% mark. The positivity rate in Mumbai also is round about at 18%. Also, there's been a slight decline when it comes to the total number of cases in the city of Mumbai, and this is also reflective when it comes to the hospitalizations. For example, Delhi, the hospitalizations are increasing right now. Data from the 11th of January shows that hospitalizations in Mumbai, however, are showing a bit of a decline. Many then questioning whether the worst really is over for Mumbai or not. But experts say that we have to wait for a little longer to gauge the situation right now to then come out conclusively and say whether the worst is over for the city of Mumbai. Make no mistake, the third wave is very much here. India, remember, took 10 days to reach 1 lakh cases in the Omicron wave of the pandemic. Mathematical projections indicate that by end of February or so, India will reach its peak, but this wave may not linger on. Here's more. The the third wave is sweeping India. The country is seeing an exponential growth in COVID cases. India reached the 1 lakh mark in just 10 days this time. The 1 lakh figure was reached in the second wave in 50 days and 120 days in the first wave. On Thursday, India reported more than 2,47,000 infections in just 24 hours. Mathematical projections indicate that this is going to rise further.
ये बहुत ज़्यादा तेज फैलने वाली सुनामी जैसी लहर है। जो आंकड़े हम देख रहे हैं, ये पहले आंकड़े कभी नहीं देखे। टेस्टिंग संख्या और टेस्टिंग लैब्स के ऊपर भी उसका थोड़ा स्ट्रेस हो गया है। तो टेस्टिंग लैब और इंफ्रास्ट्रक्चर पे स्ट्रेस जरूर हुआ है, लेकिन उसकी जो तीव्रता है, जैसे आपने सही बताया, वो बहुत कम है और अस्पतालों में अभी अगले 2-3 हफ्ते में हमको पता चलेगा, बहुत ज्यादा इसका इम्पैक्ट नहीं होगा।
While experts differ on when India will peak, most agree cases will decline by the end of February.
In cities like Delhi, Mumbai, where the numbers have been rising very fast for past week or so, they will continue to rise very sharply, with the peak estimated somewhere around middle of this month. That is, in about a week, 10 days from now.
India had such a terrible Delta wave. That combined with vaccination efforts suggests that there's quite a bit of immunity in India that will provide some protection against Omicron. So what we expect to happen is lots and lots of Omicron infections, reaching a peak in the end of January or first week of February.
Doctors say it is not the caseload we should be looking at this time, but hospitalizations and ICU admissions.
What is different from the Delta wave so far has been that the number of people who require inpatient hospitalized care is substantially lower than it was for Delta.
Sources within the INSAGOG, the consortium of labs undertaking genomic sequencing in India, say that in metropolitan cities, the prevalence of Omicron is to 90 to 95%. They also say that Omicron is well on its way to replace Delta as the predominant variant in India. Well, the rate of infection is much more, but hospitalization and oxygen use is not alarming. Far from it is what sources indicate. In New Delhi, Sneha Mordani for India Today. Well, this week also saw the Government of India start administering the third dose or the precautionary dose for the most vulnerable frontline workers, healthcare workers and senior citizens with underlying healthcare conditions. This report gives you an idea about boosters and how you can go about taking them. Also tells you whether you are actually eligible to begin with, and if not, when can you become eligible.
60 वर्ष से ऊपर की आयु के कोमॉर्बिडिटी वाले नागरिकों को उनके डॉक्टर की सलाह पर वैक्सीन की प्रिकॉशन डोज का विकल्प उनके लिए उपलब्ध होगा। ये भी 10 जनवरी से प्रारंभ होगा।
Finally, the much-awaited moment is here. India has started vaccinating its eligible population with the precautionary dose, popularly known as the booster dose, from Monday onwards. Healthcare workers, frontline workers, and those above the age of 60 with comorbidities are eligible. Appointments for the third vaccine shot earlier opened on CoWIN. This is the online appointment facility. There is no need for new registration for those taking the precautionary dose of COVID-19 vaccine. The government has even said that those who do not want to take an appointment online can do a walk-in. There is no need for a comorbidity certificate to be produced before the third dose. Those who are taking an appointment or walking in must know that their wait for the third dose might just get longer if 9 months have not lapsed since you got your second dose. Also, if you're infected right now, then you have to wait for 3 months for your precautionary dose. Well, if you've had an infection recently, then again, you have to wait for 3 months since the day you turned negative. The government has also said that the third dose will be of the same vaccine given in the past to the recipient. Mixing of doses is not allowed.
The precautionary vaccine dose that will be given to healthcare workers, frontline workers and individuals 60 years and above with comorbidities will be the same vaccine as has been given to them previously.
Government sources say that there have been concerns about severe reactions in mixing doses, a risk they could not afford to take. Experts, however, say that this is not the best way forward and that using a third type of a vaccine for the precautionary dose should have been ideal.
There is a group of people who hold divergent view. They think that booster should be of different vaccine because it may elicit more immune response and protect you more. However, more research and more data are available. Till that time, please follow the government's diktat and immediately go for boosters.
The only outcome measures we have now are based on mRNA vaccines, which also have the ability to boost the antibody levels 28-fold, which is a lot more than inactivated virus vaccines as well as adenovirus vector vaccines.
Bharat Biotech, the makers of Covaxin, however, say the indigenous vaccine will offer long-term protection as a booster dose as per a study done by Bharat Biotech and the Indian Council of Medical Research. India, meanwhile, is seeing an exponential surge in COVID cases, courtesy the fifth variant of concern. As healthcare system feel the pinch because of the surge, the need to protect the vulnerable is non-negotiable. In New Delhi, Sneha Murdani for India Today. Well, that's all we could pack in this show today. Continue to watch this space for all the necessary information on the fifth variant of concern, Omicron. We simplify it for you and get you the best, the most comprehensive reports. Thank you for watching.